Building healthy communities and supporting people to create their own community projects is an effective way to help transform people's lives. Our reporter joined locals in London, where residents have developed healthier and tastier opportunities for themselves and their neighbours. Julie MacDonald reports.
In the shadow of Canary Wharf is Poplar, an area of London rich in diversity and with big ambitions to bring its community together and make people healthier at the same time. The Aberfeldy Centre here in East London is the heart of the local community, and it's inspiring thousands of people who live here to look after themselves differently. The project is called Well London, and Victoria Coakley from the centre told me why it's transforming the community.
The Well London project is all about getting the community to design and choose the projects that are really going to make a difference to their own health and well-being.
Residents wanted to learn new skills, so gardening was just one course on offer.
The idea is to allow them the opportunity to grow their own fruits and vegetables. So they're each allocated one of these little food growing boxes so that they can then grow their own produce, that they can then improve their diet by eating more healthily.
Paula Paul was out of work when she started to get involved, setting up a fresh fruit and veg stall at the centre. She then graduated to running the cafe so she can gain the skills to manage her own business.
I love to be here because it gives you get to see everybody, and it gives you the confidence with like talking to people. I become more confident, and it's a lot of change for me because it shows me how to do a lot of things, you know, and help the community.
And because local people get the final say in what their community projects deliver, it's proving to be quite a success.
When residents do it for themselves, other residents see, well, I could be doing that as well, and it really sort of rolls along and snowballs.
Are the students visiting Buckingham Palace? No.
The Royal Society for Public Health works to train volunteers like Rosa to increase their confidence in supporting the health and well-being in the community. Rosa's working as a volunteer at the centre, teaching IT skills and English. She's helping these Bengali women to better their language skills.
It's where everybody meets and where everyone can also express their potential. They really do give you the opportunity here to develop whatever talent you have or whatever idea you have. So it's not just me coming here and helping these ladies, they've actually given me so much themselves.
Dr. Soman Banerjee believes Well London has hit on the right formula to help people become healthier.
I think when a lot of the initiatives that came before made assumptions about what people wanted in their communities and they didn't check back to see whether those were actually what people wanted and what people valued. So the difference with the Well London programme is that it really starts by listening to the community. When we measure the impact, we ask people actually what impact has this had. They talk about really significant impacts on well-being, around improvements in physical activity, improvements in healthy eating, and also just generally in terms of the sense of their control over their lives.
The Royal Society for Public Health is now working with the University of East London to export the Well London approach nationally. Academic Patrick Toby has been following the initiative, and he's convinced this approach could provide a blueprint for other communities in need.
We've seen it work here, we've seen it work in more than 20 other communities, and we think this should be something that should be mainstreamed in the way local authorities work.
The Aberfeldy Centre remains a hive of activity, and thanks to Well London and the enthusiasm of the people who live here, it's a community firmly in bloom.